Hi, welcome back to Straight Talk. We're talking with Devon Blackwood, who's written a book called Beyond the Lingo, which is a book about addiction, and it breaks down all the phases of trying to help someone, where to go, how to do it, and as the book says, it goes beyond just the words. And we're talking with Devon and kind of walking through the process of getting somebody help. And we talked the first segment about intervention and what that's like. And hopefully the intervention leads to a person wanting to go for help.
Right, absolutely, yes.
What's the next step? How do you figure out what's the best program for someone to go to?
Yeah, well, it depends. If it's the very first time that someone is going into treatment, sometimes they might need a detoxification, especially if it's someone engages in dependency patterns, meaning that they have a dependency to the substance, like alcoholics, for instance, who drinks. When they stop drinking, they get sick, they go into withdrawal. That person might actually need a detoxification where they go into a hospital setting or into a detoxification center where they get the medical help that they need. And that's very, very important for family members who's not very familiar with various forms of treatment, to understand that detoxification is very important, because it's very, very difficult for people to actually stop using unless the substance is first out of their system. And to say to the heroin addict, you've got to stop using, you've got to stop using, but yet not help them to get into a detox or appreciate the fact that they need detoxification first is sort of invalid.
So a person who's an alcoholic or heavily addicted, for somebody to say, stop,
right,
you know, that's not realistic.
Right, no, it's not.
Because if they do just stop,
yeah,
like you said, something could happen physically.
Yeah, absolutely.
So they need help.
Right, absolutely. Well, you know, Mike, the idea that addiction is just a mind over matter thing is really not true at all. It's just a myth that so much people have held for so long. And what is so surprising too is that there are many addicts who's in active recovery who actually say to other people, well, I didn't need detox, I stopped cold turkey, so why can't you do it? Well, everybody's addiction is so different. Our bodies, you know, react and respond differently. And no two persons have a very similar, same genetics, so addiction affects people in various different ways. But there's also a counseling program too that can very well involve the family. But the very first, I guess the very first step to take is first the intervention, and then after that, getting the person into a treatment setting and identifying, having professionals help them to identify and analyze exactly what will this person benefit from.
Now, often, a lot of times, you'll hear someone say, you know, they need to go away. They need to go into a treatment center.
Yes.
You know, and I guess the classic 28-day treatment center has been on everyone's mind, or we're going to go away to a treatment facility. I remember when the Betty Ford Clinic opened, everybody was trying to say, well, that's what we need. How do you know the difference between someone that needs to go to a residential, long-term, be away somewhere, living somewhere, versus the person who can just go see a counselor, a therapist, you know, and go into a regular drug program and still live home? How do you know the difference?
That's an excellent question, Mike, because during my consultation, sometimes with physicians at Hopkins as well as the nurses would say, well, you know, how are you able to differentiate with who needs what? Well, many times it really involves a comprehensive clinical assessment, meaning that a full history of a person's drinking or drugging behaviors, as well as their medical and legal and social and family and psychological issues is really, really looked at. And based on the outcome of that assessment, that's really when good clinicians determine what will be the best treatment for this person. Now, another aspect of this, though, is that there are many people who's been to a tremendous amount of treatment programs. Some have gone away to other states for 6 months and 30 days here and 60 days here, and somehow they really cannot seem to get an extended period of sobriety. So every time that they come in, clinicians are more likely to think that, oh boy, you know, let's send them off again to a 28-day program or a 6-month program. They might not need that at all. They might need 12-step groups. All that person might need at that particular time is going to a 12-step meeting every single day, but 7 days a week, and getting a sponsor, something different. In other words, treatment is very important, but not all the time the person might need the same thing over and over again. Perhaps they need a different perspective, a different view.
And I think a lot of times people feel that because a person went away to a program and then started using it again, that treatment doesn't work.
Right.
So you hear that all the time. Oh, he's been to a dozen programs and he hasn't stopped.
Right, absolutely.
How do you respond to that?
Yeah, well, treatment does work. It is really what people put into it. The fact is, and it's sort of sad anyway, because some people will die in the addiction. And that's the very, very sad thing about addiction, Mike, because, you know too that there are some people who have committed suicide, or some people who have overdosed, or some people who have suffered grave medical conditions as a direct result of the addiction. And it's just very sad. So much people die, but so much people really do get the help. And that's the good part about it. In the 12-step groups like Alcoholics Anonymous and Narcotics Anonymous, there are a tremendous amount of people who are solid, productive role models with mended lives.
So what you're saying is, don't quit.
Right,
Just because it didn't work, over here, doesn't mean you stop and give up.
Right.
You got to keep trying different things.
Right, absolutely. But treatment is also for the open-minded individual. First of all, it really starts with motivation. There must be some sense of motivation.
But most addicts
want to get.
But most addicts want to keep using. You know, so we're going to talk about it. I know in our last segment, I want to talk about motivation, because I agree with you. And everybody says, you know, you can't help them unless they want help, and they can't. Exactly. You know, but the key is motivation and how to get them. And we're gonna talk about it. But I want to talk about your book again, because this is such a helpful book.
Yes.
We're talking with Devon Blackwood. Here's his book, Beyond the Lingo. It's a great book that can help walk you through the process of getting someone help in a treatment center. And when we come back to Straight Talk, we're going to talk to Devon a little more about motivation, how to get somebody in that treatment center, and then what happens when they come back. So stay with us. We're coming right back to Straight Talk.